of course, projects do not enter a market. It's always solutions.
How the rewards are going to be shared and how the risk will be shared is really, really crucial.
I just hope that ecosystems will continue to stay in dialogue with each other through initiatives like the THCS partnership.
Ecosystems in Health and Care, the THCS podcast.
Pilots prove what's possible. Ecosystems with vision and skin in the game prove who's in it for the long run. In episode 4 of the THCS podcast, Ecosystems in Health and Care, we talk about this crucial turning point with Gerda Geyer, THCS Work Package 9 lead at the Austrian Research Promotion Agency, FFG, who focuses on strengthening ecosystems. Johan Moyersoen, expert on value-based business models from Belgium, and Riccardo Farina from the ecosystem Trentino Salute 4.0 in Italy, where digital health services have grown from a pilot into a lasting ecosystem. Again, thank you very much. Thank you, Gerda Geyer, for being here, Johan Moyersoen from Belgium, and Riccardo Farina from Italy. I'm very happy to have you here and very pleased to host this podcast episode together with you. So Gerda, what's the first thing that comes to your mind when you hear the phrase after the pilot? I think we all know the problem. After the pilot ends, after the project ends, projects die and do not transform into sustainable ecosystems. So what comes to your mind when you hear after the pilot?
I mean, when I hear after the pilot from the funding agency's perspective, I think it's really an interesting phase. Because a pilot normally is done to gain experience, to gather facts, to have interaction with end users, and to learn how a specific solution, a specific approach works in the field. So that's a very important phase and a very important stage of a project. And after the pilot, of course, a lot of different avenues are possible because in the best of cases, your assumptions have been verified, your hopes have been fulfilled. But then there are different also stages of gray, so to say. So you might also have learned things that you did not anticipate, or you might have learned about failures. You might have seen additional aspects that did not come to your attention before. So it is a very instructive thing to do a pilot. And after the pilot, it is to decide on whether to proceed or stop.
Or not. Yes.
Stop an endeavor. And I think normally you can then also really understand who is in the thing, in the solution, in the approach full-heartedly, and also with the support of a strategy behind the strategy from your enterprise strategy, from your research organization, so that you can continue. Or you just decide that with the funding ending, you would turn your attention to other things. But after the pilot is a very important phase.
It absolutely is. And Johan, in your view, what keeps an ecosystem alive once the funding ends?
That's a really good question. And to answer that, I do think you have to go before, during the funding, that there is really a strategy alignment between all these actors in that ecosystem, because often in ecosystems in healthcare, it's not only health actors, these are also companies involved, public authorities, local authorities, civil society, which have all their own agendas and are really focused on their own impacts. And therefore, there has to be strategy alignment. And I like really the analogy of you have to have the shift between isolated impacts for every organization towards collective impacts. Because if you don't have this general view for what this ecosystem serves, then it's really difficult to create accountability and also to create a shared business model where impact and economic return comes together, but the impact is really something collectively owned. And that's really important, because if you don't do that, then it's really difficult to distribute risk and rewards across the system to really sustain the model.
Absolutely. And Riccardo, you are here because you have a beautiful case study, Trentino Salute 4.0. Have you witnessed a project that successfully transformed into a lasting ecosystem?
Luckily, yes. And
Great.
I would like to mention one experience in particular. In 2016, in the framework of our ecosystem, Trentino Salute 4.0, we promote a trial involving the prescription of the digital diabetes diary app to pregnant women with pre-gestational diabetes and also to selected cases of young people at the onset of the disease, with the preference given to those who live far from the main hospital. After the initial phase of co-creation process and preliminary testing of the diary with a number of volunteers, the diary was prescribed to 17 women who used it daily from the first weeks of pregnancy until delivery. That pilot action is currently an application and technological platform of the provincial health systems of the Autonomous Province of Trento that supports home management and telemonitoring of all patients with diabetes, which is fully integrated into TreC Plus, which is the personal health record we have in Trentino. TreC Diabetes, this is the name of the app, allows patients to keep a health diary and receive guidance and support from a chatbot, while healthcare professionals can monitor the data transmitted, personalized treatment plans, and also communicate with patients, promoting self-management and patient well-being. So from pilot action to service.
That's really fantastic. So in this case, it really worked out really well. But Gerda Geyer, from your perspective as the THCS work package lead, why do so many good projects fail to transition into sustainable ecosystems? It can work. We just saw it can work. But why is it?
Yeah, I mean, we also have quite some good examples of projects that came forward with solutions and new approaches and were also successful in the market. In THCS, we do not yet have concluded projects, so we just started funding in 2023, so all our projects are still going on. And THCS, I would like to mention that also is based on the experience of 4 different pre-existing initiatives, and one of those initiatives was the AL program, the Ambient Assisted Living program, or in the second edition, Active and Assisted Living joint program. And what we tried to do in designing THCS was to take also into consideration the learnings of the pre-existing initiatives, and in AL we have done some major learnings, what it really takes to support projects so that they come closer to the market and have a higher chance of then being also sustainable on the long run. One very important aspect is that, of course, projects do not enter a market. It's always solutions, and it's specific partners of a consortium. A project has a completely different goal than an ecosystem that is really walking on the ground. So I think that's also something that needs to be mentioned. And in the way of developing a solution, you have the different stages of innovation. You start with the basic research, you then enter the phase of the industrial research, then experiential development, and if all goes well, in the end you will reach the market with the market entrance. Then, of course, along that avenue, you need different kinds of consortia. In the beginning, you need a lot of research institutions that really provide the knowledge, and the closer you come to the market entrance, the more law, you need to take into consideration also enterprises or different kinds of end-user organizations or stakeholders that will help you to position your solution in the market or to prepare the uptake and the inclusion in work streams and in processes, in regulatory frameworks and so on. So I think that's very important. And what we have done in AEL was to design the calls increasingly in a way so that consortia took into consideration the different kinds of stakeholders, starting from end users to also the policy level or finance partners, insurances and so on, so that all the aspects that then lead to the successful completion of a pilot, in the best of cases, are also taken into consideration while the project is running, because of course we are talking here also about social capital. It's a lot also about relationships, but it's also about preparing, for example, the financing for a new approach or a new solution. We know that from projects that were not successful in reaching the market, that were then not taken up, the lacking financing of the solutions or the new approach was one of the major issues. And of course, all those aspects need time. That's not done just because a pilot has shown to be successful, that the other day you meet stakeholders and the finance is there. It really needs to develop, it needs to be taken into consideration all through the project in terms of needs, in terms of wishes, but also in terms of practicalities, in terms of also strategic backgrounds that might be there at the national level, but also at the regional and local level. And in a way, it's necessary to take into consideration those different levels, from the micro level over the meso level to the macro level, because there might be different strategies and you need to combine them in order to be able to be successful. But of course, we also know that there are many barriers to the success, and the lacking finance is one of them. Then also that different partners in a consortium might be owner of different components. So the one organization or the several organizations that would like to bring a solution to the market might be dependent on a partner that is not willing to let go of a component or bring in a component, and those are very common factors. And one last thing I would like to mention, because normally it's overseen, but we have seen that also as a very important feature. That's the individual, the personal component. Because of course, everything is fine and somehow regulated as long as the funding is there and you have a consortium agreement. But then after a project ended, it just really takes some time, and it can also be up to, let's say, 1 to 3 years until you really have positioned your solution on your new approach. And you need a person who is really dedicated, who has a vision, or a group of persons who are really dedicated and have a vision and can also establish the communication channels with the larger network so that everybody is aware of the vision and can buy in the vision. Because in effect, you always need more than just one institution for being successful, especially on the long run, and especially in the health and care area that are so complex areas.
Yeah, it's very complex. You need many stakeholders. Right. And I think you mentioned something very important. It's not projects that enter the market, it's solutions. And for solutions to enter the market, you need business models. Johan, you have a very interesting approach to business models. It's called value-based business models. So can you please tell us what are value-based business models and how do these models change the way actors share risks and rewards?
Yeah, thank you for that question. Yeah, indeed, in the last 30 years, you see a whole evolution in business models in healthcare, but also in other sectors, in the energy sectors, where it's not only about selling a product, but it's also really generates the outcome, the value that we want to obtain. It's a really strong evolution that you see in different sectors and also in the healthcare sector, where you the traditional model, is our volume-based models where people are selling products that has a functional outcome, and the business model is how more products you sell, how more revenue and how more profit you can make. But then you see a whole evolution already in the 80s about product service models where certain products are combined with services to have better uptake, better adherence. The people understand much better what the treatment is about, and these product service models wants to really be more effective to the patients, and demands more coordination, often between companies, service providers, and products. Then you saw a whole evolution, what is typically called value-based models, where they say, no, it's not only about adherence, we want to really see also the health outcome coming as a result of it. And so it's really another paradigm where you really want to measure what the effect is of a certain health path or treatment path that someone is following, and to see that this really results to better health outcomes, and and that people get a reward on that, which really brings that there's a whole reshufflement also in the service provision. Actors becomes more interested in also in proactive healthcare, where we want to foresee certain prevention measures that the complications are avoided at the end. So you see a whole other coordination coming up, where as a health outcome is really important, that people are looking, organizations are looking how to reduce the cost, to be very precise and to be very effective, which is a lot of other coordination coming on. But then you see also inclusive value-based models, where it's not only about certain groups of patients, but really that it has also effect on certain vulnerable or more difficult to reach groups, which often requires also other actors coming in, where in the value-based models you see companies and healthcare actors working together to get to these results, or sometimes also with insurance companies. In inclusive models, you see that also social organizations are getting involved. And then you have population-based models, like TreC, where you want to have effect on a full population, on health outcomes, on health costs, on patient experience, and so forth, like these AAA models coming in. And there you see that also a lot of local authorities are coming involved, and it becomes really a broad partnership where the risks and rewards are very different to develop. And what I want to say is that on your question is that if you go more and more to these more complex models, innovation becomes really important. And in my view, how to incentivize the innovation part in these models to improve, further improve, and to the outcomes becomes really important. It's not only about sharing risk and rewards if the outcomes are met, but also incentivizing that innovation in these models to really have an iterative process where the ecosystems become better and better in understanding what the population is and also what is needed.
Yes, thank you very much. I think that's really powerful and would be very useful for each and every project. Fortunately, Riccardo, with you, we have a really good case study where things like that actually worked. Trentino Salute 4.0 has grown from a local competence center for digital health into a recognized model. What is Trentino Salute 4.0? What are its main outcomes? And what were the decisive steps in this journey? Can you unpack it for us?
If I have a couple of hours, maybe.
In 3 words.
Thank you very much for the question. So, Trentino Salute 4.0 is the competence center for digital health, which was formally established in 2016 with the Provincial Government Act, following a commitment expressed in the Provincial Law of Health of 2010. It is jointly managed by the Autonomous Province of Trento in the role of the decision maker, the local health trust in the role of provider of the service, and the Pro Bruno Kessler Foundation in the role of technology and research partner. Also, it is open to companies and citizens following a quadruple helix approach. Trentino Salute 4.0 has 4 main strategic goals. The first one is align the agendas of the relevant stakeholders in e-health services, cover the entire supply chain in health services from research to innovation, accelerate the process from testing new technologies to implementing innovative health services, and implement effective 4-helix approach through co-creation processes. The core outcome of the ecosystem is TreC Plus, which is a personal health record representing the unique gateway for all health services in Trentino, including health reports, prescriptions, booking services for visits, televisit, or blood tests, also choosing or changing general practitioner, managing accessibility to own data, enabling telemedicine services, and more. If I have to consider the main stages towards the creation of this ecosystem, I can say that the first one was the vision expressed in the Provincial Law on Health in 2010 regarding digital health, and also the factual succeeding implementation of the center in 2016 with a clear policy endorsement, with a governance structure, and also with a funding scheme.
So you had a clear vision, you had a clear funding scheme. Gerda, what are other critical enablers that help ecosystems move from emerging to consolidating and eventually to beacon ecosystems?
Yeah, I mean, partly that's the mission of Work Package 9 to find that out. We already have some indication on it. And what we try to do in the first place is to support projects in embarking on an avenue that goes beyond just having in mind the own project goal and being completely concentrated on the own consortium. What we would like projects to do is to see the larger ecosystem in terms of stakeholders that are necessary and that are around the solution or the approach that consortia are developing. In the best of cases, that starts even before writing a proposal. So you should be in touch with the relevant end users, with the relevant stakeholders already when designing an idea, when designing a project. And then it would accompany a project throughout the project duration and have its reflections in the work plan, because of course stakeholders engagement also needs time, it needs resources, it also needs a plan. You need to know when and how you are going to include them, when and how you are going to test, for example, an assumption. And it also needs resources, because on the consortium side, of course, you also need the time in order to be able to reach out. But by doing so, we know from the AL example, but we also know from other approaches that that the likeliness for being successful is much higher than if you do not take into consideration the stakeholders right away. In effect, it all sums up to understanding better how your solution or your approach fits in the larger puzzle, the larger jigsaw puzzle so that it really works. It also takes into consideration the work streams, it takes into consideration the strategic setting, it takes into consideration the financing aspects so that you can prepare them and build the ecosystem that will be necessary for guaranteeing sustainability for the approach that you have envisioned as being the one that really contributes to an improved health and care system. So that's the first thing. Then once a project has been concluded and the solution is on the way to the market, it seems that it is also important to take into consideration the evolutionary character also of an ecosystem. I mean, it's not a static organism or so. You need to continue to be flexible and adaptable to new needs. New partners might join in, others might leave. You might just adapt the solution or the approach. So I think that's very important that you start thinking in terms of larger networks, larger ecosystems, but then also in terms of flexibility and adaptability and working on the common vision and working on the alignment of strategies and of activities.
Yes, I think it's definitely very important to include the stakeholders from the very beginning. I had the chance to work with some health startups in Austria, and only the ones who actually did that survived.
Right.
The others actually did not.
Yeah,
Only the
right.
ones who involved the stakeholders from the very beginning. Johan, in your experience, how do we actually make the stakeholders co-own the risks and the rewards? Is that even possible? How can we get everyone to have skin in the game?
Yeah, skin in the game. That's indeed very crucial because shared value sounds always nice, but it's really
Nice.
referring to bring economic return and societal impact and health impact together, but creates also a lot of conflict of interest between organizations. For example, if you invest more money in prevention, there will be less work in cure, and the cost efficiency will be there. And how you can then ensure that everybody benefits out of it is a really an important tension point in value-based models. And one remedy on that is, of course, that we need shared indicators, that organizations are looking on the same indicators and share these data together, that we have really a shared view on what's going on, and that they know what are the impact criteria that we want to work on, and if they are met, how the rewards are going to be shared and how the risk will be shared is really, really crucial. So my answer is, you need this shared alignment, but you have also to be able to measure it, because if you don't measure it, it's really it creates fuzziness, which allows creates a lot of ground of conflict of interest. So you need really that transparency of indicators, and that people can see what's going on and understand what the repercussions are in the upside and in the downside if we are not meeting these elements. And again, I do think because if you invest in value-based models, the work of healthcare will change, and so we have always to think about innovation, and where actors can really reinvent what they are doing and to develop a new functionality in the ecosystem.
Absolutely. I think that's really crucial, and it's very important what you said. How did you do that, Riccardo? You were successful in doing so. Did you discuss risks and rewards among the stakeholders? And the other question, how do you keep partners committed and engaged when the initial project is over? How did you do that, actually, in your case?
We could say that Trentino Salute 4.0 is like a big umbrella under which several projects are carried on. So when a project comes to an end, it doesn't affect the engagement of people who are part of the ecosystem. Also, Trentino Salute 4.0 can rely on a well-structured governance entrusted by two bodies, the steering committee and the executive committee. The steering committee is responsible for defining and proposing the high-level strategies, so the guidelines, we would say, of Trentino Salute 4.0, overseeing their implementation and evaluating the results achieved. While the executive committee defines the programs, plans the activities, ensures the implementation of projects, and the monitoring of the results achieved. I would like to add also that the executive committee meets. We meet on a monthly basis, so quite close one to another, and there is a program manager and all project manager working in the center to be aligned on ongoing and upcoming activities.
So I hear a lot about common vision, clarity, also owners, right? Project owners who are actually committed, who have skin in the game, but you need a lot of clarity to also have everybody on board. And Riccardo, what is one lesson Europe should remember about sustaining ecosystems beyond projects from your example?
Well, I think that many healthcare systems across Europe are facing the same challenges. So, staff shortages, demographic change, digital transition, policy fragmentation, just to mention the main ones. Ecosystems must be supported because they can address these challenges with a holistic approach, identifying all the interconnection between them. Without ecosystems, each stakeholder must face their own challenges, believing that they depend only on them. And that requires more resources, greater effort, but produced less effective results.
Absolutely, I think that's very powerful. That's really clear. It has to be like that. Johan, how could funding be organized in other ways?
Yeah, I do think it's really crucial if you want to really sustain ecosystems for healthcare in Europe. I do think there are three main elements that should be in the funding mix. Is one, it's really structural funding for the back office. What Riccardo is saying is completely true. Without a coordination, a back office, uh, it's 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 really difficult to sustain an ecosystem, and it's really difficult to find funding for that, and because it's hard work, and but it's so crucial. It's really the central intelligence of an ecosystem. So there has to be structural funding on these back offices to coordinate that shared vision, that shared strategy, these indicators, this shared measurement to bring that forward. If there is no transparency, if you don't have this back office, that it falls completely apart. Secondly, is yeah, out, outcome-based funding models where funding is not given for volume but for health outcomes on or on job satisfaction of the health personnel or on patient experience should be indicators that funding is given to really push these ecosystems in that direction. And thirdly, there is also a need for investment. And investment because there are new things developed, but also where in investment where all partners can benefit in it. How many times I do see that in these ecosystems, companies are really well prepared to invest in certain innovation, but the healthcare actors, the non-profit actors, are not doing that. But if they are not in the skin in the game and that they are not reaping the benefits out of it, it's really difficult to develop really balanced partnerships where risk and rewards are shared. And so I do think this inclusive investment of the different parties where in these funds are really crucial for these ecosystems. And last but not least is really evidence-based. You need to really think about if you set up these new interventions, is to get the data to measure it and also to learn from it, because every experiment in an ecosystem should be generate the data to scale it up across Europe. And if it's that not done, it's a huge investment to pilot test these technologies, but we are not generating the evidence that it works, and so also not the basic for scaling up, and that's really a missed chance. Thank you.
Thank you very much. Each and every one of our guests talks a lot about outcomes. How much health and well-being did we really create? I think that would be a perfect wish for the future. But Gerda, one wish for the future of health and care ecosystems in Europe you have?
I mean, one wish, and that's more my personal wish. I think it would really be nice to invest also some research and development money in looking at how we keep people increasingly healthy. So I would like to have the focus a bit more on health and care systems that try to keep people healthy and do not mainly focus on the treatment of diseases, but try to enter the game a bit before. I know that, of course, it is necessary to invest a lot of energy and money in treating persons, but from the research side and from the development side, I think it would be good to look at completely new approaches, at completely new also value-based business models where you can combine lifestyle factors, habits that you have with health, with a healthy approach and with keeping up your health. And I think also data could be used very nicely in that approach. Completely new constellations of partners and ecosystems would be possible. And also some incentives, of course, would be good. Some new incentives for people to keep up a good health. I think that would also be worthwhile for all of us to try to contribute to avoid diseases among persons and the need for care by just helping people in assuming healthy lifestyles and a good approach to their own lives.
I think that's a beautiful wish for the future. Thank you very much, Gerda, for that. Is there anything else you would like to leave us with today, Johan, Riccardo? Anything else you would like to add?
What just has been said on health outcomes, I do think it's something we should cherish, is to really to think about how to innovate in the whole health path to create solutions that keep people longer home, that the patient experience is much better, and that is really geared to preventive care. And I do think these population models are really a good model for that. And so what I would suggest is really to invest further on these models in an evidence-based way, because I do think there's a lot of experimentation going in Europe, but we don't know too much what's really working in the different regions, and we are not sharing these best practices across regions. And I do think that's really important to have that.
Thank you very much. Riccardo, final words?
Well, really brief. I just hope that ecosystems will continue to stay in dialogue with each other through initiatives like the THCS partnership, for example. And I really want to thank you for this.
Thank you very much. So for me, it only remains to say thank you very much for being a guest on the THCS podcast. I think the whole initiative is really great. And I wish for us all a future of health and well-being. Thank you very much.
Thank you.
Thank you.
Thank you.
You've been listening to episode 4 of 6 of the THCS podcast, Ecosystems in Health and Care, a podcast about the future of health and care in Europe, told through the voices of the people making it happen. Each episode brings together real-world ecosystems and visionary experts who are breaking silos, building trust, and transforming systems. One aligned action at a time, THCS stands for Transforming Health and Care Systems and is a 7-year initiative funded by the European Commission. This podcast is produced by THCS Work Package 9, which focuses on strengthening ecosystems, the key to tackling the complex challenges of today's health and care systems. Because collaboration is not the end of innovation, it's where real change begins. If you liked this, we have more for you. There are 5 more episodes on Spotify, Apple Podcasts, YouTube, or wherever you get your podcasts from. See you in the next one. Ecosystems in Health and Care, the THCS podcast.